First we will demonstrate the basic functions of Redsense. The fiber optic sensor is situated inside the sensor patch. It is the fiber optic sensor that reacts on blood from a dislodgement or a smaller leakage. When a smaller leakage occurs, the criteria which needs to be fulfilled to get an alarm is that blood comes onto the fiber optic sensor and triggers the alarm. The patch will absorb the blood until it reaches the fiber optic sensor inside the sensor patch, and then you will have an alarm. In this clip, we'll try to simulate a sudden burst of blood due to a venous needle dislodgement. And as you will see here, blood will reach the fiber optic sensor inside the sensor patch with some speed, and you will have an immediate alarm. In this clip we will show you the importance of placing the sensor patch right. In this example, the sensor patch is dislocated. It is placed up on top of the needle, which makes a small gap between the sensor patch and the patient's arm. And as you can see, when a minor bleeding occurs, the majority of the blood is slowly leaking on the side and is not absorbed by the sensor patch. Have a look at the tip of the fiber optic sensor. As you can see, there is no blood on it. And when there is no blood, we won't have an alarm. This is an example of how the sensor patch should be attached on the patient correctly. In this example, the sensor patch is correctly attached to the patient. And you will now hear that we also get an alarm from a smaller leakage. Take a closer look at the sensor patch. In this example, the sensor patch is correctly attached to the patient. And in this example, this is the amount of blood required to get an alarm. There is also a possibility to use an extra piece of tape to tape down the sensor onto the patient's skin. This is mainly to prevent from the gap which can occur between the patient's skin and the sensor patch. This could be used for patients with an uneven fistula, for example. Please note that the sensor patch always needs to be in direct contact with the skin throughout the whole treatment. When connecting the connector to the alarm unit, be sure to hold the connector on the transparent part. This is due to the sensitivity of the fiber optic cable. Either side on the connector can be connected to the alarm unit. In this example, we'll show you what happens if the connector is disconnected from the alarm unit. The Redsense alarm has been designed so that the force to disconnect the connector is much less than the force to pull off the sensor patch from the patient. This is of course for patient safety reasons. When the connector is disconnected from the alarm unit, an alarm signal will sound and the yellow alarm light will flash. When the connector gets displaced from its original position, or slowly pulled out, you will also have an alarm. The yellow warning light indicates that the sensor is not properly connected to the alarm unit, even if it appears so in this picture. What you need to do is to attach the sensor to the alarm unit correctly, turn the alarm unit off and turn it on again and make sure it's working. To prevent the sensor from being pulled out from the alarm unit or the alarm unit falling off the patient, make sure the alarm unit is secure on the patient's clothing. If needed, fold the clothing. In some situations, you may use the Velcro strip to attach the alarm unit on the patient. Note also the loop on the sensor cable. This is to gain more flexibility.